The doctors were lying to me on a daily basis. Nurses were lying to me on a daily basis. Everything that was in my brother's notes was different from what I was being told on a daily basis.
You're here to tell us about your brother, James. And,
that's correct.
We know that James sadly died in Ninewells Hospital in Dundee on the 5th of October 2021.
That's correct.
And he was 41.
Yeah.
Yeah. And you tell us a little bit about him. In your statement, he was a chef and he worked all over Scotland.
Yeah, that's correct.
Did James have any children himself?
Two.
You also say that he was kind, he was helpful.
Very. Heart of gold.
And you describe him as generally as a healthy individual.
Yep.
Okay. I think after trying to get in touch with NHS 24, your brother was taken to A&E at Ninewells.
Well, I thought he was in the best place. I thought he was just going to get a drip and, you know, he was in there for like dehydration and everything would be okay.
In paragraph 15, you say that you now know, or you know now, that they were trying to put him on a ventilator.
That's correct.
How did you come by that knowledge?
Because I obtained my brother's medical records.
Mm-hmm.
And I read them, every page.
And what was your reaction to finding that out?
That my brother must have been scared. And I was angry.
Why were you angry?
Because the messages that I was getting from my brother, and obviously he didn't tell me how scared he was. And, you know, I don't know, I was angry. I was angry. I was angry because the things that I read in his notes wasn't what the doctors were saying to me on a daily basis. The doctors were lying to me on a daily basis. Nurses were lying to me on a daily basis. Everything that was in my brother's notes was different from what I was being told on a daily basis.
I think you mentioned to me a few moments ago that you were able to keep in touch with your brother.
It was only for the first couple of days. My brother went into hospital on the Friday night.
Mm-hmm.
By 10:30 on Friday night, we were told my brother was going to die. We were communicating via messages and stuff like that. Brother, you okay? And, you know, he was texting back and I got a thumbs up in one of the picture messages that he sent me. You know, I was telling him that he had to eat and he was going to be okay and get some fluids and that into him. And so that was happening for the first couple of days. That happened over the course of the weekend.
You note that things went a little bit quiet and you discovered from his records that your brother had been given lorazepam.
Yeah, so I think that was the night that he was ventilated. So he got ventilated early hours of the Monday morning, which was the 21st. Went into hospital on the 17th of September. He started to become, you know, that like he wasn't responding. I'm saying, brother, are you there? Are you there? Answer me. Just even a wee thumbs up. Just give me something. But I think it was by tea time on the Monday night. You know, I just wasn't getting any responses from him. So I'd phoned the hospital and I asked them, says, have you given my brother anything? Because they told me that he was on a CPAP hood, but he may start to get tired. So then I asked him and he told me that he was eating and he was drinking and he was good. And then I asked him, have you given my brother anything? Have you made my brother tired because he's not responding to me? So there was quite a discussion with one of the nurses. It got a bit heated.
What was your attitude towards your brother possibly being put on a ventilator, or indeed his attitude to that happening?
We didn't want that to happen.
Why not?
Because the chances of coming off one weren't good. That was quite evident. You were seeing that people were going on them and not coming off them.
You say at paragraph 25 that he developed the ventilator-associated pneumonia, or VAP.
Yeah, so
Is that something you found out afterwards?
yeah, so I had a friend whose husband had also been in hospital with COVID, and he was on maximum oxygen for 3 weeks. So what I couldn't understand is why the ventilator was being pushed on my brother. And I'm not a doctor, but I thought, why can you not just give my brother maximum oxygen for 3 weeks if that's what it takes? Why is there such a hurry to put him on a ventilator? Sorry, with regards to the ventilator-associated pneumonia, nobody told me about that. I found that out later.
That was something you found out from his records?
Yeah.
In the early stages of the pandemic, COVID-19 patients with severe respiratory distress were often treated aggressively with intravenous fluids and mechanical ventilation. It became apparent, however, that intravenous fluids could exacerbate fluid in the lungs and further reduce oxygenation.
What he did tell you was that James had a cardiac arrest.
That's correct.
And I think one of the infections that your brother had was MRSA, which had caused damage to his face. A death certificate in relation to your brother was released, which certified that cause of death was SARS-CoV.
SARS-CoV-2 was the only thing on my brother's death certificate.
Right. Okay. And I think you make the point there was a very small discrepancy about the actual time of death as well.
Yeah, and that also brought into question whether or not my brother was resuscitated.
You've asked for a considerable number of investigations into how your brother died.
Yeah, that's correct.
And can you just tell us about those investigations? What investigations have you asked for? What are you looking for?
Well, what had happened was my brother was put on a trial, and I found through his notes that the signature wasn't his. It was a study investigator, I believe, signature that had signed him up for this trial. Now we've got a man that didn't go to doctors, didn't have any medications, he was allergic to penicillin. That's about all we knew. So these trial drugs and stuff, I had a query about why my brother was given these drugs. Could anything have happened to him by being given these drugs? Was it an allergic reaction that he had? That was about all I knew at the time of his passing, until I obviously obtained his medical records and then found out lots of other things. By reading through the records and discrepancies of the time of death, and then all the infections that he had, and being lied to on a daily basis from the doctors, I tried to then get a private post-mortem. I was supported by my funeral directors to contact Health Improvement Scotland.
Presumably from having read your brother's medical records, the various hospital-acquired infections that were disclosed.
Yeah, this is
one
a
of the things. I'm sorry. Just give me a moment. The one thing that you do make a note there is that you also found out that he'd been prescribed an immune suppression drug, which may have made him more susceptible to those infections. Is that right?
So that's the toximolobab. That he was given that, and what that does is suppresses your immune system. Now, he was already vulnerable and in a hospital. He didn't have these infections when he went in, and then he ended up with all of these.